Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking with Infectious Disease Specialist, Dr. John Brooks. Dr. Brooks, we talked just briefly about who monitors all of this around the world and why do they do it? Can you tell us a little more about that?
Absolutely. So in the United States, we have the CDC, that's the Centers for Disease Control, and they've been doing this since actually the early 1900s, because back in the day, influenza was one of the major causes of death. When we looked at what happened to us as a society back then, influenza and pneumonia was actually the #1 cause of death. They didn't know about cardiovascular disease. They knew a bit about things, but really it was that seasonal infection that would come through. And if you sit and think about the 35-year-old guy that's a farmer with 4 kids, gets influenza and dies. These young, healthy people did. So it was epidemiologically, that's a study of infections at a population level. It was important. So we've been studying it for years and years and years. So what happens is the World Health Organization, now that's the global organization, they work together with our friends in Europe also to look and see what virus is floating around, because the influenza virus has the ability to change, and it changes quite rapidly. So the goal is on a yearly basis to see what is it, what's floating around, what's it becoming, and let's go ahead and find and predict what's going to be the most likely virus, the influenza for that year, and then make our vaccine based on that.
In your experience, with all of this work, have they been able to accurately predict the severity of the flu season?
So what'll happen is that they can give us some clues, because the H1N1, like we have right now, tends to be about as serious as the H3N2 virus, except those are names that we give them. The H3N2 tends to affect young people and old people about the same, where H1N1 tends to be more serious for the older people. So we can get some clues, depending on what virus it is, of how it's going to affect the population.
So this year's is H1N1. That's like the H1N1 we talked about a few years ago?
Exactly. It's basically the same one, but it changes every year.
Okay.
That's what the viruses do. What I like to think about is that you've played cards.
Right.
So there's the 52 cards in the deck, and there's always the same 52. But the order you pick them up determines, like the game, right? Well, the viruses, they have a genome. They have their genetics. They have their genes. Well, the way that they're sorted and put together determines whether it's H1N1, H1N2, H3N2, H5N1. It's like the cards. And so it's the assortment of those genes that determines which virus it is. And that assortment determines kind of how infectious it is.
Okay. So a few years ago we talked about, was it H5N1?
Yes.
And
that
do we
would have
still
been
have that?
the bird flu, right?
The bird flu.
And people were so worried about that, and that was actually in Thailand and in our Asian countries. And that was serious because that causes a very serious pneumonia, and many people who get the H5N1 actually die. Of course, we've not had that problem here. It requires a situation where people and animals are living very closely together, because it's actually an avian, which is a bird flu. It lives in them, and people in close contact can then pick it up and acquire it. So not our usual situation here.
Well, we're going to switch just a little bit and talk about what most people think is the flu, and that's gastrointestinal symptoms. What is that caused by?
So as we kind of started the program, that's one of the things that people often will say, oh, I have the flu, and they immediately mean GI stuff.
Right.
That they have some nausea, they've thrown up, they have diarrhea, maybe some crampy abdominal pain. They usually don't have much of a fever though, and that's what they often will say when they have the flu. Well, most of us that have those symptoms is actually food poisoning, because that's actually the most common thing that happens to us. And then the next most common is norovirus.
What is norovirus?
So norovirus is a very common viral infection, and we get it from our kids. Kids are the source. They're the ones who have it. They're not immune to it. They have terrible hygiene habits, and they spread it to us very readily. So it's a virus. It's very easy to get. We only need about 10 viral particles to actually ingest that, because that's what happens. We touch it and we ingest it, and then we get the viral infection. Now the problem with norovirus is that in our society now, what do? Alcohol-based hand cleaners, right? We're always doing our hands. It doesn't work against norovirus. So only soap and water works against norovirus, which is why it spreads so much in daycare centers and in schools, because it's hard to wash hands so frequently, and the alcohol-based hand cleaners don't work.
So how do you keep it from spreading?
So basically hand hygiene, and people that are ill to keep them away from the other people. When you have norovirus, while you have diarrhea, you're infectious. When your diarrhea stops, you're no longer infectious. And it's short-lived, it's a day or two.
Okay.
So basically, it's just cloistering people, right? You get sick, keep them away from other people, and go from there. And one of the tricks is for family members, though, is that when they're caring for people with it, wash their hands, and they use bleach on the commode, because that's really the only effective way to clean it well. So that is one of the tricks for the bathroom cleaning.
Wow. You talked a little bit about food poisoning, and I guess how would you know if you have the norovirus or food poisoning?
So it's a tough one. In general, it doesn't really matter, except if you're a kid. Now, in children, they have norovirus, they can get dehydrated rapidly, and so then they often need to seek medical care. They need to have IV fluids if they can't ingest enough fluids to keep up. So norovirus in children tends to make them more dehydrated, where most of the time with food poisoning, which is what we usually get as adults when we have those symptoms, in the United States, poisoning by food, which is basically bacterial infection with Staphylococcus aureus, Bacillus cereus, they are actually toxin-producing bacteria, and you've ingested the bacteria that made a toxin. The toxin is ingested, and that's what actually makes you sick, which makes you violently throw up, you get crampy abdominal pain, you get diarrhea. It's because you've ingested a bacteria with toxins.
Okay, but it's not contagious food poisoning?
No, it is not contagious where norovirus is.
Okay. Really briefly, because we're going to run out of time, but I got to pick your brain. C. diff, that's another.
So Clostridium difficile is a bacterial infection, and as we talked about, when we talk about antibiotics, that's what we're trying to do in our world, right? Reduce how many antibiotics we give people. Certainly don't want antibiotics for a cold. We want antivirals for the flu, but when we do get sick, we give antibiotics. Well, antibiotics disrupt or change the normal amount of bacteria that's in our colon. And what happens is this bacteria called C. diff can grow up and make us quite sick. It makes another toxin. Here we talk about toxins again. It's a toxigenic bacteria. The toxin attacks the lining of the colon and can injure it and actually cause it to start to die off. So people can get profoundly sick from it.
And it is contagious.
It is highly contagious from person to person, and usually exposure to antibiotics puts you at risk for getting it.
Okay. You've given us a lot of great information. Do you have closing comments?
So what I will say every time I get a chance to talk about influenza is please get your vaccine. Although there may not be a great match, people who get the influenza vaccine, if they do get influenza, it still reduces their risk of getting seriously ill or dying. So it's still really important to get their flu shot. And hand hygiene.
Thanks so much for joining us.
Thanks, Barb.
And thank you for joining us for McLaren Port Huron's Today's Health. If you have any questions about anything we've talked about, please call us at Health Access. That's 1-800-228-1484, or you can always go to our website, and that's mclaren.org/PH-contact. You know, you can get reliable health information. You can get a copy of this program, so next year, when the flu starts going around, you can plug it in and check it out. And that's mclaren.org/PHTH. We hope you join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, doing what's best.